All right, so I'm going to share with you how to manage your time without missing important care as a nurse. Being constantly feeling behind is a sign your workflow needs improvement. Time management is not you rushing faster. It's about you learning and knowing what deserves your attention first. And as a nurse, that is something that we need to understand. We need to learn to prioritize. Start your shift off by identifying, your high-risk patient, because you don't want that patient to die on you. When it comes on to your time-sensitive medications, you need to identify those and address them. And the treatments that cannot be delayed, you need to address those. Then you organize your shift into blocks. You do your assessment first, your medications next, and you document throughout your shifts as you go along. You need to start avoid constant distractions. I think a lot of times we focus on certain things and that is distracting us from our patient care. The unnecessary back and forth trips to the rooms, yes, we need to do that. Cluster your care. Delayed charting is another problem. We tend to forget certain things because we are delaying our chart, and so we don't get a chance to create that clinical story. Yes. The other thing is when it comes on to our support staff, we try not to be using them up too often. And that is a problem. So we find ourselves feeling so stressed out because we're trying to play that super nurse because we feel as though we can do everything. No, that's why we have our support staff there, because they are there to help to take on some of the responsibility. They have their specific roles and responsibility. So it helps with providing the best care for the patient. And if we're not utilizing our support staff, if everybody is not, doing their due diligence as it comes on to their responsibility and their role as a healthcare worker, then when it comes on to time management and providing the best care, the workflow is going to be causing us to feel like we're not managing our patient properly. And time management is going to be a problem for us as a nurse. And in order for us to manage our time properly, that includes us delegating different responsibilities to the appropriate personnel that are there with us on the shift. I know that it might come across where persons might not like you. Yes, they might not like you because you're delegating, but it's a part of your responsibility. It's a part of your job description as a nurse, a staff nurse, to delegate duties to support staff. Don't feel bad about you delegating a duty once it is within their scope. Nurse, you're able to delegate duties to your LPNs, your CNAs, your practical nurses, and that will help with your workflow, and it will also help with you managing your time properly and reduce the stress in general on the floor for your nurses and help with the patient outcome. That's how I feel. So when I go out, this is how I, manage my time as a nurse. Some persons might like it, some persons don't like it, but at the end of the day, it reduces my stress. It helps with the patient getting more care, better care, and in the end, everybody win. This is how I go about with managing my time and ensuring that the patient get the best care by utilizing this technique. And, as I said, sometimes you're going to be liked. Not all the time you're going to be liked, but it works for me. And at the end of the day, it's all about the patient. It's all about the patient. And if you have a good workflow and if you're managing your time properly, the patient will get the best care. Let me know how you're doing with time management. Is that something that you're struggling with as a nurse, as an international nurse, a new grad? Let me know in the comment box and we can have more conversation as to how we can try to help you in that aspect. Until then, I'll see you in the next video. Remember to go ahead and subscribe to my YouTube page here at ThinkNursing